Ehrlichiosis is a serious tick-borne disease that affects dogs worldwide. It is caused by a type of bacteria called, which invades and destroys white blood cells, crucial for a healthy immune system. These bacteria are transmitted through the bite of infected ticks, primarily the brown dog tick. When an infected tick latches onto a dog and feeds on its blood, the Ehrlichia bacteria enter the dog's bloodstream. Once inside, the bacteria target white blood cells, multiplying and spreading the infection throughout the body. This can lead to various health problems, ranging from mild to life-threatening depending on the severity of the infection and the dog's overall health. Understanding ehrlichiosis is crucial for dog owners, as early detection and treatment are paramount in preventing serious complications. Recognizing the symptoms, understanding the risks, and knowing how to protect your furry friend can make all the difference in their well-being. Ehrlichiosis is a complex disease with potentially devastating consequences. But knowledge is power. By being informed, you can help keep your beloved canine companions safe and healthy. Ehrlichiosis risk is present year-round wherever ticks reside, but it escalates during warmer months. This is because ticks are most active when temperatures are above freezing, particularly during spring and fall. During these periods, ticks are actively seeking hosts, and dogs spending time outdoors are more likely to encounter these infected parasites. Hiking trails, wooded areas, and even our backyards can harbor ticks lying in wait for a potential host to brush past. However, it's crucial to remember that ticks can still pose a threat beyond these peak seasons. Mild winters and climate change have contributed to ticks surviving in areas they previously couldn't, increasing the risk of ehrlichiosis transmission year-round. Therefore, vigilance is key, regardless of the season. Regular tick checks, especially after spending time outdoors, are crucial for early detection and prompt removal, minimizing the risk of ehrlichiosis and other tick-borne diseases. Ehrlichiosis can manifest in various ways, making it a challenging disease to diagnose based solely on symptoms. Some dogs may remain asymptomatic, showing no outward signs of infection, while others may exhibit a range of symptoms, from mild to severe. The initial or acute phase of ehrlichiosis typically occurs within 1 to 3 weeks after a tick bite. During this stage, dogs may exhibit flu-like symptoms such as fever, lethargy, loss of appetite, swollen lymph nodes, and weight loss. Some dogs may also experience respiratory problems, coughing, and difficulty breathing. As the disease progresses to the subclinical phase, the symptoms may subside, leading pet owners to believe their dog has recovered. However, the Ehrlichia bacteria are still present in the dog's system, silently causing damage. Without proper treatment, ehrlichiosis can advance to the chronic phase, leading to more severe complications such as anemia, bleeding disorders, neurological problems, and even death. Recognizing the early signs of ehrlichiosis and seeking veterinary care immediately are crucial for successful treatment and a positive outcome. A closer look: clinical signs and diagnosis of ehrlichiosis. Diagnosing ehrlichiosis requires a multifaceted approach, combining a thorough physical examination, a review of the dog's medical history, and specific laboratory tests. Veterinarians will look for clinical signs such as swollen lymph nodes, pale gums, fever, and any evidence of bleeding or bruising. Blood tests are essential for confirming the diagnosis. A complete blood count, or CBC, can reveal abnormalities in blood cell counts, such as low platelet counts, known as thrombocytopenia, and low white blood cell counts, known as leukopenia, which are common in dogs with ehrlichiosis. Specialized blood tests, such as antibody tests and polymerase chain reaction, or PCR tests, are used to detect the presence of Ehrlichia DNA or antibodies in the dog's blood. These tests help confirm the diagnosis and determine the stage of the infection. Early diagnosis is crucial for successful treatment outcomes in ehrlichiosis. Navigating the treatment path for ehrlichiosis. Treating ehrlichiosis typically involves a course of antibiotics, usually doxycycline, which is effective against the Ehrlichia bacteria. The duration of treatment varies depending on the severity of the infection and the dog's response to therapy. In some cases, supportive care may also be necessary. This can include intravenous fluids to address dehydration, blood transfusions to address anemia, or medications to manage specific symptoms such as fever or pain. Close monitoring is essential during treatment to ensure the dog is responding favorably to therapy. Follow-up blood tests are often necessary to assess the effectiveness of treatment and to ensure the infection has been completely cleared. While most dogs respond well to treatment, early intervention is key for a successful outcome. Shielding your canine companion prevention strategies for Ehrlichiosis. Preventing Ehrlichiosis revolves around minimizing your dog's exposure to ticks. This involves a multifaceted approach, encompassing year-round tick control measures, regular tick checks, and creating a tick-unfriendly environment in your yard. Several effective tick control products are available, including topical medications, oral medications, and tick collars. Consult with your veterinarian to determine the most appropriate tick control product for your dog based on their lifestyle, risk factors, and any existing health conditions. Regularly inspecting your dog for ticks, especially after spending time outdoors, is crucial. Pay close attention to areas where ticks like to hide, such as the head, neck, ears, armpits, groin, and between the toes. Creating a tick-safe environment in your yard can significantly reduce the risk of tick encounters. Keep your lawn mowed short, remove leaf litter and brush, and consider using tick control products in your yard, following the manufacturer's instructions carefully. Ehrlichiosis in dogs. A recap. Ehrlichiosis is a serious tick-borne disease that can have significant health implications for our canine companions. By understanding the risks, recognizing the symptoms, and taking proactive steps for prevention and early intervention, we can help protect our furry friends from this potentially devastating disease. Remember, knowledge is power when it comes to safeguarding the health and well-being of our beloved dogs.